And welcome to another segment of Your Health with MU Healthcare. And my special guest here today is Dr. Christopher Sampson. He's an emergency room doctor with MU Healthcare. And thanks for joining us this morning.
Great. Thanks for having me.
Appreciate you talking to us. Summertime is here, and I think we want to talk a little bit about lawnmower injuries today. People starting up their lawnmowers again. Could you go over some injuries that you most commonly see in the emergency room?
Yeah, so we tend to see, especially with this increase in the use of lawnmowers again, a rise in injuries, unfortunately, associated with them. And actually, nationally, there is a huge amount of people who get injured every year. We see about 250,000 people across the country who end up being injured from lawnmowers. And sadly, a lot of those can be small children, too.
What are some of the types of injuries that you most commonly see with people coming into the emergency room?
So the most severe injuries we would see from lawnmowers are often cuts or even amputations. That can be you're not wearing appropriately fitting shoes. Sometimes people wear sandals when they're mowing the lawn, and be it if you're on a riding lawnmower or a push lawnmower, sandals sometimes may not get you enough grip and you could slip, and then unfortunately that lawnmower then can cut toes off or injure other parts of your body.
What's the key whenever somebody comes into the ER with an injury like that? Is it getting them there quickly if they have an injury, or what would you say? Should they call an ambulance if they have the chance, or should they just get somebody there to the ER?
Probably if you've lost a limb or a digit, a finger or a toe, it's best to call 911 and get EMS there as soon as they can. In certain situations, if there's really severe bleeding, a tourniquet may need to be applied, and really that's medical professionals or sometimes even the police are able to do that, so someone is able to get there in a timely fashion and do that. Often, we need to see them in the emergency department because we need to treat their injuries. They may need to have cuts that need to be sewn up. Sometimes, unfortunately, those wounds can be dirty too, so we need to clean them out, get them on antibiotics, and treat them appropriately.
Any advice to the folks who are trying to get the folks over to the ER if they're in shock, or anything that you should be doing or saying to them while you're transporting them over?
Probably the easiest thing to do if someone's bleeding from somewhere is sometimes just direct pressure on that area can control bleeding. That's pretty simple. If you just have a clean cloth or rag, just push it on there while you're waiting for the EMS professionals to arrive.
Other than cuts, are there any other type of lawnmower injuries that you see with folks whenever they come into the emergency room?
So sometimes you may even see just bruises or broken bones, especially on riding lawnmowers, because if you get in certain areas where it's hilly or unstable territory, that is very easy for it to flip over, and then that sometimes could land on you and break your bone or give you some pretty severe bruises.
So let's talk about falls too, because sometimes you have elderly folks that are out mowing the lawn, and whenever they fall down, it's not necessarily very good at all.
No, falls are another pretty common thing. Often off ladders are the big culprit there. People are out cleaning gutters or moving broken branches, and sometimes they don't think about how dangerous it can be going up a ladder.
And there's no doubt about that. If somebody does fall, I guess you be very cautious about moving them if they've taken a fall like that.
Yeah, for sure. If somebody's fallen and they've hit their head or they're complaining of neck pain, it's probably best just to leave them in place and then call 911 and get somebody there who can appropriately splint them or get them on a board and move to the hospital.
Let's move on to some other injuries too. Tool-related injuries can be sometimes particularly nasty. I'm sure if you're talking about a saw, are there some things that you've seen like that in the emergency room as well?
Oh, sure. Yeah. I mean, probably in general for tools, the big thing is just to make sure you keep your tools clean and well repaired. I think a lot of injuries occur because people just don't take good care of the tools or the instruments, and then they're using a improper tool, and that's when it breaks or leads to injury. Table saws are probably the big culprit. They can injure people pretty easily. It doesn't take very much force to lose a finger on a table saw. My own father-in-law has actually lost a finger on a table saw, so he's seen it from the side of being treated in the emergency department.
Well, certainly too. I would imagine that possibly you could see some eye injuries too if they're working with hammers or something. Flies up into their eye.
Oh yeah, for sure. That's again why protective equipment is key. Wearing goggles or glasses if you're going to be working on any type of object, metal or anything where you could have a fragment fly off and hit you in the eye we have seen people who suffer eye injuries, sometimes permanent disability, loss of vision in that eye because of a piece of metal or something that flew off and hit them in the eye.
Another thing that folks will do is get out and start working in their yards during the summertime, and they'll possibly be burning brush or leaves or something like that. What are some things that you see along with that in the emergency room?
In this time when there's a lot of brush to be burned, you will see people who come in with various injuries. The big things is to make certain that the area you're burning the brush in is clear of other debris, because you don't want to start a fire that's going to get out of control and lead to either damage to your home or vehicle or even yourself. The other thing, the big danger we sometimes find is people burning brush in high wind times. We can see that, so it's easy for the embers or the fire to get moved out of the area you think you have it under control. Another mistake sometimes people might make is since they're burning brush, they say, "Oh, I'll just throw some weeds in there." And if that's poison ivy or sumac, you've now made that into an aerosolized format, and you can inhale that. And if people think poison ivy is pretty bad on your skin, imagine if you've breathed it into your mouth. It's going to be pretty painful and itchy. And then the other thing, the big danger probably with fires, is people don't realize is they often maybe aren't happy enough with the fire and they want to throw gasoline or some type of accelerant on. And people don't really understand how quickly that stuff can explode. So often we'll see people who come in with burns because they throw gasoline on a lit fire and the explosion burns them on their face and hands and body.
What is the key on that, too? I recently had seen somebody who was a burn victim. What is the key on that? If they're down on the ground, they're come out of the building, and basically there was smoke coming off the guy's skin. What's the key in getting someone to treatment and where they could get some care?
Sure. So if you see somebody who initially is burned, and if they're on fire, just kind of goes back to the old classic line as a kid, is stop, drop, and roll. So get them on the ground. You want to try and pat out the flames. At that point, if they are suffering severe burns, again, it's probably best to call 911, and someone can come get them to the hospital. We here at MU Healthcare, we are a burn center, so we get a lot of patients who come in to be treated for burns, and we have burn specialists that have a good experience in taking care of that. If you're still waiting for an ambulance to arrive, or if you're coming in the hospital by your own vehicle, it's okay to put sometimes a cool rag on that area just to help with pain control. But yeah, if you're in doubt about the severity of the injury, it's probably best to call 911. I
would love to talk to you too. Also, with the hot temperatures are going to be on the way, and there are some dangers associated with that. Could you give us some keys on keeping yourself from being overheated?
Sure. Again, a lot of people forget, because we've had such a long cold winter, about how easily the heat can overcome you. This is again a time that's, if you're going to be outside working, because again everyone's trying to clean up their yards or being outside, is when the heat starts to rise, is just take short, frequent breaks. That kind of gets you back into a cold environment. You can cool down. It's also to make sure too that you're drinking an appropriate amount of fluids, staying hydrated. Sometimes people get behind in that. If you're feeling thirsty, you're probably already behind in keeping yourself hydrated. And then again, some people who have certain medical conditions, diabetes, or on certain types of blood pressure medicines, those can cause you to pee more frequently, which can lead you to get dehydrated even more in this warm weather.
Talking about kids, my kids are always want to be outside. It doesn't matter how hot it is. Is there a recommendation for how long that children should be out in the heat?
I think the best thing is just to make sure that they're staying well hydrated. So if they're just call them in maybe every half hour, make sure they're drinking, or make sure they've got water bottles out there with them. And again, when it starts warming up and we've got a lot of sun out, sunscreen is probably the next most important thing, because people forget that they're at risk for sunburn because they've been indoors for all winter and forgot how powerful that sun can be.
Certainly, I know a lot of elderly folks will be working in their gardens out in that. Should they take precautions of maybe covering up their face, wearing a hat or something like this to help them shield their skin?
Yeah, for certain. As long with sunscreen, it's always good. A wide-brimmed hat kind of covers the face and the head. If you've got something that's light and cool, a long-sleeve shirt, that can also protect the skin. Sometimes it's better for a lighter color like a white, or there's a lot of those breathable fabrics out there that it's pretty comfortable even though you're wearing long sleeves when it's warm out.
If you get a severe sunburn and you need to come to the emergency room, is there anything that you can prescribe to them if they're coming to the ER with a severe burn like that? Would you recommend that they do that?
If you're ever in doubt, I mean, you can always come to be evaluated, either at the emergency department or even at urgent care as well. Some sunburns can be severe as a burn you'd get from heat. I mean, it's a similar type exposure, so we will see people who get blisters and other injuries. A lot of the focus is more just pain control. Sometimes Tylenol or Motrin people can take. Aloe vera helps, or antibiotic ointment too. You can apply if there's blistered areas.
Advice on those blisters to folks who have the severe sunburn?
The thing is, kind of either let those blisters probably be, or if they pop on their own, just put some ointment on them and keep them covered. You don't really want to be probably at home vigorously cleaning them because it can be painful. We do that in the emergency department, but often we're more experienced at it. We can put some medications that help people tolerate the pain. But most of the time, some minor blisters from sunburn, they'll heal up on their own without much difficulty.
Have I missed anything here this morning that you would like to talk about that I have not asked you about?
Probably the only other big thing we see in the time now as it's warming up, or sometimes trampoline injuries. That's another common thing. It's recommended to not have trampolines, but we know people still have them. The American Academy for Pediatrics actually is against owning a home trampoline. But if you do have one, it's probably safe just to make sure you've got the netting around them. That's the springs in the other areas are covered up to make sure children jump one at a time, and also to make sure that they're being supervised if they are jumping in the trampoline.
Can you talk a little bit about some of those trampoline injuries that you have seen at the emergency room?
Sure. Well, when the weather starts warming up, that's often we start seeing children who are jumping on trampolines that don't have the netting, and they will then go flying off it and land on the ground, and that's a big reason for broken arms, broken elbows. Some can be pretty severe and often may even require surgery.
If folks were interested in, trying to get some health care through the emergency room at MU Healthcare, how would they go about doing that?
Probably the best place is to go online and look at muhealth.org. You can get advice there on what needs to be seen in the emergency department, what can be seen in urgent care, and just some other general medical advice.